So good afternoon. Welcome to today's presentation. This is a little bit of an update of all of the activity that people across Wisconsin have been taking and with regard to federal Medicaid spending cuts and what they're hearing from their congressional representatives. We will be spending a little bit of time today going through some of the things that people have used as strategies to connect with their lawmakers and connect with other people who might be impacted by Medicaid cuts, but don't necessarily know or have the information that there are cuts being considered at the federal level. I think one theme that we discussed in previous presentations is there is a real lack of knowledge about Medicaid by lawmakers. It is a complicated program. Lots of times people don't spend a lot of time in this area. And I just want to emphasize that, all of you who have been doing such great work to connect with your federal lawmakers, you are the educators they need. And you've been doing a great job at showing them that this is an important program that impacts a lot of different people across the state. So don't ever feel like you aren't the expert, because you are. You're a person who actually uses this program, and it's important to how you have healthcare and long-term care services in your life. You know these programs because you're in them, and you know what it means if you get less help. So you are the experts. And I think sometimes it's challenging for people to say to a person who is elected, an elected federal official, that they aren't incorrect, but sometimes they are. And you're the perfect people to educate them on why these programs are really important and what it would mean if they had less funding, or that if they were changed in ways that are different than they are now. There have been a whole host of people across Wisconsin and across the country who have made calls to their members of Congress about Medicaid. And we have seen the dynamic shift over this week, that there are now signs, at least some members of Congress are hearing from enough constituents that they are questioning whether or not certain kinds of Medicaid cuts are a good idea. There does seem to be some support for Medicaid cuts, and the contacts and the education work that you are all doing is really helping inform and really change the debate. We need to keep doing that over the course of however long we are talking about Medicaid cuts potentially happening, because there's always more for legislators to learn, and they really do need to learn the impact of Medicaid on their states and in their districts, because there's many people and many jobs that really rely on this source of funding. So now we're going to get into some of the things that you've told us you are hearing when you meet with your congressional members or attend listening sessions. And we're going to play a little game. Everybody has a raise hand button. So Sally's going to keep track of this. And when I flip the slide, if the message on the slide seems like something that you've heard from your member of Congress, either in a response letter or on a phone or something else, just raise your hand. We're going to take a poll. There are a lot of slides here. And I want you to raise your hand, look around, and see how many other people have raised their hands. Okay. So the first thing that people have been telling us they've heard is about fraud, waste, and abuse in Medicaid. And we actually kind of have three different flavors in the slides about members of Congress believing that there's a lot of fraud, waste, and abuse in Medicaid. Most of the time, when members say this back to their constituents, they're not citing anything specific. There's just a belief that fraud exists. And sometimes they're pairing that belief with an idea that by removing funding from Medicaid, that will have an impact on fraud. we've kind of paired what we've heard from lawmakers with some ideas on how you might respond. And I think that when you hear something from a legislator, it's important to talk about what's real in your life and what you know. You don't have to go out and research whether or not Medicaid fraud is occurring or how much it's occurring, because that isn't that's not keeping the focus on you and the program and the things you use it for. I had somebody talk to me yesterday who had heard this from her legislator, and she actually took she's an Iris. She took the opportunity to say to the legislator, it would be really difficult for me to commit fraud because there are so many checks and balances in place. And if I don't do something exactly right, like immediately the I can't use that money. I can't pay, my staff. So we actually talk about how difficult it is for ordinary people to use the programs because the fraud and protection, um, you know, mechanisms that are in place make it so hard for ordinary people. And I thought that was a good response because, it does let the legislator know there are actually things in place that are supposed to be there to prevent fraud, and they do. In some ways, they do such a good job that it has made some of the programs very difficult for ordinary people to use. So you can take a look at some of the language that we are suggesting here and just kind of think about, how are you orienting it back to your experience, which is real, and kind of being assertive with members to challenge them on some of their beliefs. So I'm going to move to the next slide. Get your hands ready. Sally's keeping track.
Okay.
All right.
Yep, I'm going to keep track. I'm going to lower people's hands. So once you hear Tammy talk about this, then raise your hand. But I'm going to lower them all right now so I can get a good count.
There's also a flavor of the fraud conversation that makes an assumption that somehow there is a lot of money being taken from Medicaid and that it is going to foreign countries. I'm not quite sure why this is a belief, but we appear to have a couple members of our delegation who are publicly saying this. In fact, it's been reported in some media reports. And I think that it's important for us to not let that go. I mean, Medicaid money coming to Wisconsin is being used to help Wisconsin people and pay Wisconsin workers. And that is your experience as a person who either uses Medicaid or provides Medicaid services to people who are in Medicaid. That money is coming to serve you. And there's just not any proof that other countries are stealing Medicaid money. So cutting money from the program doesn't necessarily prevent any fraud, but it does mean that there'll be less money coming to Wisconsin to help people, Wisconsin people, and pay Wisconsin workers. All right, next one. There are a couple of things going on in this one. First, there are a couple of messages coming back to folks that are trying to reassure the constituents that we aren't, you won't be hurt by this, or we're doing these things, it won't hurt you, and we're doing it because we're trying to stop fraud, waste, and abuse. I think that there's no way, like, there was just a report that came out this morning about what would it mean if all of the ideas that Congress has about reducing federal Medicaid spending were included. And all of the cuts that are proposed are about 33% of the entire Medicaid budget. $2.17 trillion going to states wouldn't come to states. There aren't that many programs I can think of where if you removed 1 out of every $3 that the program had, things would stay exactly the same for everybody who relied on those programs. So I think that while it is reassuring for someone to say that you won't be specifically infected, I don't think there is any way that you could guarantee that with cuts that are this large. And there's also an idea here about somehow cutting inherently stops fraud. I'm not sure I know any person or report or study or any reason to believe that that would really be the result. All right, next. There's this is a threefer because they're all similar, but these are all things that people like you have heard. You're not the target. They won't apply to people like you, or we can target certain people. And Medicaid has many different populations of people who are eligible for and use the program. One thing that is true is that by sheer numbers, the largest population of people in Medicaid are children, they're kids. So if you looked at the total number of people in Medicaid, there are a lot more kids and pregnant moms and non-disabled people in Medicaid than there are people with disabilities and older adults. I think it's about, I'd have to look up the percentage, but there are a lower population of older adults and people with disabilities who are in Medicaid compared to, kids and other populations. However, both older adults and people with disabilities tend to have higher care needs, which means they're higher cost, and they tend to be in Medicaid programs for a longer period of time. So while older adults and people with disabilities aren't, the main group of people by numbers that Medicaid serves, they make up about 2/3 of what Medicaid dollars are actually spent on. So that should give you some idea about, when they say you're not a target or the cuts won't apply to people like you, the math doesn't work out that way. You may not be the target, but the reality is that the people who really are where most of the dollars spent will likely be the ones who are most impacted. And frankly, these cuts are so large that everyone in Wisconsin and everyone in Medicaid is impacted. So it really isn't about trying to prevent harm or make sure only certain people get harmed. Cuts this big harm everyone. All right, here's the next one. Let's see. This is less of a comment and more just of a theme that many people have reported that when they say Medicaid, the member thinks that they're talking about Medicare, which is a totally different program, or Social Security. So it really tells you that these very different programs are things that the lawmakers all see as the same when they're not at all the same. I will say that for many people with intellectual and developmental disabilities, there are people who do receive Social Security and who are in a Medicaid program and actually might be eligible for Medicare as well, depending on how many quarters they've worked. So there are people who are in all three of these programs, but the programs are very different. And I think it's important for folks to correct lawmakers and really tell them about Medicaid, because that's where the cutting is from, right? What is Medicaid doing for you that the other two do not? Many lawmakers do not understand that Medicare does not pay for long-term care. Medicaid is the place where people who need services that are associated with family care or IRIS or CLTS, that's where they are. So I think that you should not be afraid to kind of correct lawmakers and make sure that you're actually having a discussion about the right program that they might be making a decision about. All right, I'm going to flip the screen again. Sometimes when folks have talked about calling offices, there's kind of been a desire to make the person who's called do the work of researching the lawmaker's position instead of actually stating their position to the constituent who's called. And sometimes I haven't done this for all of our congressional delegation, but sometimes when they say my positions are on my website, there may not be any positions on the website. Or in the case of one of our members, they don't have any positions on Medicaid. They have positions on the Affordable Care Act, which again is different. So it isn't a bad idea to go to your person's web pages and kind of look at what are they putting out there, because it may give you some ideas of what they do and don't know. If you've called before or you've left a message or you've sent an email or they've told you my positions are on the website, go to the website and see what they're talking about, because a lot of lawmakers apparently don't have very many positions on Medicaid, and that gives you something to ask them about specifically. All right, we're going to flip again. So sometimes lawmakers have reassured constituents that they don't believe those cuts will happen. And everything that we have been watching develop over the last several months has been very consistent. It is the same menu of Medicaid cut ideas. It's the same coverage in the press that very clearly says Medicaid is the place that Congress may look to cut to fund other priorities. And certainly there have been publicly published lists of spending cuts that are out there in the media. So I think when somebody says the cuts won't happen, that is a way to try and have you not pay as close of attention. The only way these cuts won't happen is if constituents make enough connection with their lawmakers to let them know that cuts are not a good idea, and that if they happen, there's harm and they should not do things that will cause their constituents harm. So you are going to be the people who make sure the cuts don't happen, and they're the people who are going to vote on whether or not those cuts happen. I think that it is an easy thing for members who don't have their daily lives really dictated by whether or not a Medicaid-funded personal care worker is able to get paid that day. Their life may not change, but for a lot of the folks that we work with, even really small cuts to the help that they get now may mean big changes in their life. So, of course, we should be worried, because any amount of disruption could be really life-changing for a lot of their people. And it is important for folks to understand, like, if you're saying these cuts won't happen, what makes you think that? Why do you think that's the case? Are you talking with your colleagues? Do you know there's not enough votes to make it happen? That's today. Is that going to stay the same? I think there's a lot of questions that you can ask if you get a statement like that. I'm going to move on to another one. We don't intend to hurt people with intellectual and developmental disabilities. That is perhaps a true statement, that there is not an intention to harm this particular population. But again, given that we are the highest cost population that often needs the most help for the longest period of time, and that more Medicaid dollars are spent on this population and older adults than other populations in Medicaid, it's likely that cuts will end up disproportionately harming the people who need the most care over the longest period of time. So again, it's another educational opportunity to talk about all of the ways that Medicaid touches your life and your family's life, because you are going to be the people who feel those cuts first. All right, changing again. Another version. Well, we don't want to hurt this particular population, so we'll put protections in place so you aren't impacted. That's really difficult to do. When you're talking about $2.17 trillion in cuts and certain things that, which will mean states have a lot less money to pay for what they already do. And then there are certain states or certain things that states have to pay for, like institutional care, that are high cost. Big cuts to Medicaid aid for states are going to result in states either having to pay a lot more money just to do the same thing, or that states are going to have to change what they're doing to match how much money they want to spend. And states really only have three different levers they can pull. They can make decisions about who they do and do not cover in Medicaid. In other words, choose to cover fewer people. They can make changes about what they choose to pay for, what services. And again, there's eight covered Medicaid services every state has to do, and a whole bunch of others that are optional, including everything that you know about family care, IRIS, and CLTS is in that optional category. And they can change how much they pay providers. So those are the three things that states really have the most control over. When you think about what protections how would you protect a certain population that is, again, needs the most care over the longest period of time and has the highest cost, that it gets hard to see how that happens for everybody who is in the program right now, especially when many of the services that they need are optional. So the funding mechanism that has been in place since 1965, where the states know roughly how much federal money is coming in that will cover whatever the actual Medicaid costs in, is actually a really good deal for states because it gives that certainty over the long haul. And there's certainly people who need Medicaid for a longer period of time. All right, we're going to the next one. I see lots of hands getting raised. This is exciting. A different version of the same statement is this idea of exemption, where we're going to define a certain group of people and then say, well, whatever rules we have for anybody, for other people, don't apply to these people. That's what exempt means. And I think that there's sometimes people feel comforted by that because they think of themselves as being in the exempt population, but that's where it gets tricky. When you define who has to go by certain rules and who doesn't, there are always people that think they should be in the exempt population that end up not being in the exempt population. Exemptions always mean that there are some people who think that they should be exempt who are not included in that exemption. And who's in the exempt grouping can change anytime if the rules change. So there's definitely people with disabilities that need help who would be kept out of Medicaid or would be subject to, different rules or different things that they have to do than they are now, which might impact whether or not they can get into or stay in Medicaid. A great example is Badger Care. Badger Care is the so-called able-bodied Medicaid program for Wisconsin. And I say so-called able-bodied because there's actually a lot of people with disabilities who are in Badger Care. People with serious and persistent mental illness are probably there or in MAP. There are people with intellectual and developmental disabilities who don't meet the functional screen for family care or IRIS who are in Badger Care. There are people who are waiting for a disability determination from Social Security Administration or other places who are in Badger Care while they're waiting. And there are certainly people with chronic or intermittent conditions that can be debilitating, and the place for where they are is in Badger Care. Badger Care also covers a lot of the paid caregiving workforce. About 25% of our paid caregiving workforce who are serving people in family care and IRIS are getting their healthcare coverage in Badger Care. That's also true for many unpaid family caregivers who have had to reduce the amount that they can work or leave the workforce entirely in order to care for other people. And those groups would probably not be exempt. They're not people with IDD, but they are a very important group of people who help support people with intellectual and developmental disabilities. So I use that as an illustration of, you can think you want to target the able-bodied Medicaid population. There's a program that serves that group of people, but there are also many, many other people within that able-bodied program who have disabilities and probably wouldn't be exempt from whatever the spending cuts or other rules are that they expect to be applied to a certain group and not to others. All right, next one. This is actually a true statement that it will be the states that get the bag of bad decisions handed to them on how to cut Medicaid programs. So federal Medicaid spending, like reducing the amount of money that comes to states, does put states in a position where the only thing they can do is either spend a lot more of their own state dollars to essentially fill the budget hole that is created and keep keep things operating exactly the same, or they have to cut their programs to fit the size of dollars that they have to spend. And again, the only choices states really have are deciding who to cover, deciding what to pay for or not pay for, and deciding how much to pay for those things. So handing states a reduction in federal Medicaid dollars really means they're telling states, you're going to have to cut a lot of money from your state budget. We won't tell you how to do it. You guys figure that out. Okay? And I think that there's really room for Congress to understand how much those federal spending cuts mean, not only to individual people, but to Wisconsin workers and communities. That removing 33% of the federal Medicaid dollars that are going to, from the system, there isn't a way that states can make that up. And that decision at the federal level is going to make a scenario that will hurt states, first of all, because state budgets are more than just Medicaid. So even if states want to spend more on Medicaid, that means they have to spend less in other places. And some of those places are also important to people with disabilities and communities. So this decision about removing a lot of money that's going to states hurts the states that our federal lawmakers represent, and they impact everybody who's living there. All right, moving on. Anybody heard this one? This is again a true statement. The federal government is not cutting specific Medicaid services. They're telling states, you get to decide how you want to cut, right? So it's a different version. There are some advocates at the national level who are worried that some of these pieces of legislation the federal government may consider might also include changes to what is current federal Medicaid law that might impact whether or not states have to do certain services. So there's a little bit in here where you have to watch that, say if you change what services are required, that you say there's a service that all states have to do right now, and if the federal government were to change and say, well, you don't have to do some of these things anymore, that would be a signal to states that this is again some place that they could look to reduce their Medicaid budget. So the federal government isn't being very specific about here's what you have to do, states, but it's creating the conditions that states are going to have to cut their services and redesign their programs, either by reducing the amount of people who are eligible for the services, reducing the number of services that are covered, or changing how much people who provide those services are paid. Okay, next one. These cuts, who's heard this? These cuts won't occur right away. It isn't uncommon for any piece of legislation to include a date when changes take effect. So while I have not heard any specific dates that would lead me to believe these things wouldn't go into effect right away, it almost doesn't matter because the scale of the cuts is high enough that whether it occurs, 1 year from now, 2 years from now, or 5 years from now, doesn't mean that that cut won't have a big impact on the people who rely on services. And as costs continue to go up, when those cuts happen, becomes even harder to predict what the impact will be the longer it goes into effect. We're almost done with this. All right. Has anybody heard this one? Where it's true that there hasn't been a bill that's publicly released, I think there's enough reason to understand what the ideas are that are being considered, right? And remember, once something is in a bill, that often indicates that there is agreement by enough members of Congress that that is a good idea and that there are votes that would support that idea happening. So in some ways, you don't really need to see a bill to understand what are the ideas that are already being talked about to be included in it. By the time you see it in the bill, it is telling you there is agreement, and then it is harder to get that removed. There is a big package of ideas that is fairly public here, and some of those ideas were actually in a bill that failed by one vote in 2017, specifically Medicaid block grants and per capita caps. A lot of these things are not new ideas, and they have been talked about for months, both publicly, and they do appear in documents that are the menu of things that budget committees are considering. So I think that there's enough reason and enough documentation and evidence that it's pretty clear what the ideas are. And yes, we will read the bill and see what it actually says, but we shouldn't be surprised, and we should maybe question whether lawmakers really don't have any idea what is going to be in the bill. Certainly, this is another way that you can help educate and say, here are the 6 things we're worried about. What are your positions on those items? So this is challenging for a lot of individual people, but it's important in this moment. You are the expert in how Medicaid touches your life, and you are probably an expert more on what Medicaid is than many lawmakers. So you can be assertive without being impolite, and you may need to correct lawmakers if they say things that are incorrect or don't match your experience. It's important to keep engaging with lawmakers because as we go on through this process, lots of times what you hear from lawmakers may change, and it can tell you whether or not they're moving more towards maybe we shouldn't make some of these cuts, or maybe they're moving more towards these are things that we agree with and we are definitely supporting. Oftentimes, as we have had in 2017, for example, the lawmakers would listen to what constituents were saying, and then they'd come up with a response, and then constituents would have to say something else. That is part of the normal process, and the key is that everybody has to be watching and engaged and being responsive to, as things keep changing, sometimes in a matter of days or hours. And just remember, whatever the lawmaker is saying to constituents, unless it's a absolute promise that nope, I don't support Medicaid cuts and I won't vote for them, you may, they may change what they are saying, but the important part is what they're saying indicating that they've changed their opinion on how they might vote on Medicaid cuts. Okay. So that's the end of the hand raising. Sally, do we have any winners? What was the thing that people heard the most? Do you know?
There were two that were about equal. Your loved one won't be harmed in kind of that
Okay.
area. And then similar in nature, don't worry, these cuts won't happen. And then I would say the third, which was just about the same as it will be up to the states to decide.
Okay.
But there was not a single one that people haven't heard. So
Okay.
just so you know,
Well,
somebody's heard all of these.
Okay, I thought that there may be a lot of people who'd experience this. And as you keep engaging with with your lawmakers, keep telling us what they're saying, because that really helps us help prepare people, as they continue to meet with legislators. So, what have some of your other friends been doing? Here are some ideas that many people have told us they have been doing across the state that might be things you might want to do. Most lawmakers have newsletters. This is a great place. Get on a mailing list, and they'll send out a whole newsletter to constituents. It tells you where listening sessions are going to be. Oftentimes, it will tell you what they're prioritizing in terms of messages to constituents. Is Medicaid part of that or not? That tells you something. Sometimes they actually try and get a flavor for what are the top issues that people are concerned about, and they might construct a poll. All of these are great ways to show your support for Medicaid or ask questions. Many members have social media accounts, and a lot of folks have engaged with those social media accounts to make comments about supporting Medicaid or specific responses when their lawmaker has posted on health related policy. It's important to look at what they're saying or not saying. And we offer this caution that there are lots of artificial intelligence things that automatically respond to comments. Don't engage, don't take it personally. Understand it is a non-human that may be trying to make you angry or force you or get you to reveal more information. What's important is that staffers understand which comments are coming from real people, and you can make those comments. So many folks have been calling both the office in Washington, D.C. Every senator and congressman has an office in D.C. Many also maintain an in-district or more than one in-district office if it's a U.S. senator. And I've put up here the different roles that those offices have. It's worth calling both, right? So you have a DC, you call the DC office, you ask to speak with their policy staff, you make sure that they know that you are a constituent concerned about Medicaid. Many people have also called the in-district office because that role is slightly different. It's really about responding to constituents. And a lot of folks have had good success getting meetings in the in-district office. Sometimes folks have had success getting virtual meetings with the DC office, and there's no reason to not try and do both. Many people have talked about asking for the lead policy staffer who deals with health or Medicaid policy. This is a pretty important person in the DC office. This is the person who is advising the congressional member on policy and what to do, support or not support. So this is a person that is in supposed to be the office expert on Medicaid. Sometimes the offices have been reluctant to give out the name or an email address or a contact for their office expert on Medicaid. And we know of a couple of constituents who have been very persistent and have gotten that information. And they've, said things like on this slide that, this is an important issue and, we want to be directly engaged as a constituent with the person whose job and focus is on Medicaid. We've had a couple of folks ask, well, how do I request a meeting? You can use something different than this or the same, but it's here for you as a guide to help you write your own script. It doesn't have to be very long. This is like 3 sentences long, but it has been pretty effective for people to get meetings. Many people are meeting one-on-one, but lots of folks are meeting as part of a group. And so if you know people who are in your people with disabilities and others, it could be providers, it could be, any group of disability related folks, you might want to get together and have a meeting where there are several people who show up. We always think it's a good idea to plan those meetings so that everybody has something that they can say and everything that is said is kind of helping to emphasize the point of why Medicaid is important and that you shouldn't cut it. It can be very helpful to do a prep meeting beforehand. And if you want some help on thinking about how you're going to run the meeting that you get. Most meetings are about half an hour, so it's not a lot of time. We are able to kind of provide that assistance. Just give us a contact. Some ideas of what to say when you get in the meeting. Medicaid has such a deep impact. Some of you may have attended a previous webinar we did. Feel free to use this sheet to kind of gather your thoughts about what Medicaid matters to you. But I also think it's really helpful that providers and others who have a different vantage point are thinking about how Medicaid helps pay for salaries and how many people they employ and how many things that people they serve, how much of their clientele is Medicaid. These are important viewpoints that really lawmakers need to understand to get the full scope of how Medicaid is important. We're going to listen to Nancy. Meet Nancy.
Hello, my name is Nancy Gopinski, and I'm from Glendale, Wisconsin. Medicaid is very important to me because it has been a support to my son who has autism since he was a little boy, and it's helped us with things like intensive in-home treatment services, medication, respite, and it's been a godsend for us. And it also has been very helpful in the past. to help my mom, who had a lot of chronic health conditions, remain at home with us and not have to go to a nursing home. She was able to pass away peacefully at home with her family surrounding her because of home and community-based services through Medicaid. So, and this is a picture of my mom and my son. It was the last picture I ever took of her. It was in March of 2020. But she died peacefully with us at home, which had been what she wanted and what we wanted for her. So we'll always be grateful to Medicaid for that. Thank you.
Whoops, what? I did not mean to click on the link. Sorry, people. That was just a great example of an impromptu way that you can get your Medicaid story across. Great job by Nancy, kind of telling her whole Medicaid story in about a minute. That was made on a normal cell phone, uploaded on a link, and you can make your own messages or messages from people that you know, and take them with you to meetings or send them to your lawmakers. For folks, for individuals who rely on Medicaid, another thing to keep thinking about, another thing to say as we go through these weeks where we're going to have to keep engaging with lawmakers, great idea to think about how many people does your life impact? How many workers are you engaging with whose salaries are paid for by Medicaid? Your care needs support a lot of people's jobs, and these Medicaid funded jobs support unpaid caregivers' ability to work. So that's another exercise that you can think about as an individual, like who are the people that you interact with? And I bet you it's going to be quite a few people that are all, doing some amount of work to help you stay in your home or get the help you need. I think the same thing is true for providers. Map out the impact of your business. And I took an example that was shared with us, or part of this example. Think about how many people you support and what you support them with. In this case, it was an employment provider. So you have the number of people, there's a number of hours that those people they're supporting are working. There's an impact, they're connected to employers. And when you think about the work that this agency is doing for 246 people is resulting in 157,000 hours of work that is provided to other community businesses. That's a really powerful way to talk about how Medicaid dollars are really resulting in an investment that pays off for the whole community. Here are some examples of things that people who have had meetings with members of the congressional delegation have asked for. So some things are asking for commitments to not vote for Medicaid cuts or a Medicaid forum or in-district listening sessions. Maybe you have some other ideas, but here are, if you're having a meeting and you don't know what to ask your congressman for, this is a list that you might draw from. Lots of folks have reported they have attended in-district town halls. Often those town halls are covered by the press. So it's a great opportunity for you to be prepared, just like Nancy, and share your story. She did that story in under a minute. And it was really impactful about, to talk about how that program mattered. Again, you don't have to do it alone. You could get a group of people together. It's often important for members to kind of see that there are many people who are talking about similar issues from different perspectives. And a lot of times when that happens, the press covers those issues because it's reflecting what constituents are saying. We have a number of resources, and you will get these when the recording goes out, that might be helpful to you, and you can use them as handouts for any meetings that you have with congressional members, or to include in emails, for example. So you can peruse those as your interest, but what is Medicaid in Wisconsin? Medicaid specific fact sheets for Wisconsin. We have a couple examples of those, and you can go to the Department of Health Services website and figure out by county how many people or the percentage of people in your county rely on Medicaid. Now, it doesn't count how many workers are paid by Medicaid to provide health or long-term services for those people, but there are many counties in the state where the number of people on Medicaid is above 25%. In some cases, closer to 40%. And a lot of those counties are rural. So Medicaid really isn't a urban or rural issue. It's a Wisconsin issue, and there are people across the state that really rely on Medicaid, and a lot of providers who rely on Medicaid as a stable source of money. So the other thing that lots of people have done is to try and help more and more people understand that these cuts could be coming. Folks have told us that they are members of lots of different groups and that they have shared information with those groups. Some folks have talked about how they've contacted their relatives in other states and discovered that their relatives didn't know much about these cuts. And so they've asked their relatives in other states to contact their congressional members. These are all great examples of, just people connected to each other who are helping spread information and asking others to become engaged. We have included here how to make a Medicaid story pitch to the media. Some of you may have contacts with local reporters or talk radio or other things. So here's some language that you can use. And a sample Medicaid letter. Again, you can modify the language in here however you want, but sometimes people like to start with something. So if you were writing a letter to the editor or maybe an email or trying to help people understand what's happening, these are two things that you can draw from. Other ideas of where to share your story. Some people have done some of these things. Again, we're starting to see some coverage of Medicaid cuts beyond kind of the big old school media. And I think that's really important because now we have lots of people get their information from a lot of different sources. We haven't talked much about engaging with the state legislators, but Disability Advocacy Day is coming and there's 600 spots. And every person who registers meets with their state senator and state representative. The registration will be going live on Monday, next Monday. Make sure that you can come because we have limited spots and we need everybody to really show up. But if you are able to come, think about who you can register from your area, and then maybe you can give them a ride. So most of you know who your elected officials are. I'm going to go quickly through this. It is really helpful. It's been so helpful to have to know from you what you're hearing from them. Please continue to let us know what your members are saying when you're meeting with them. It's just super helpful to understand how they're thinking about Medicaid and Medicaid cuts. And I think we'll probably close on this slide. When we're thinking about who else to get engaged in this discussion about whether or not Medicaid should be cut, there are some people that may or may not be engaging right now that should probably be part of the voices on Medicaid. So, even as you're talking to your lawmakers, talk with other people who are in the Medicaid system. Ask your care managers, ask your personal care agencies, ask the providers who are funded by Medicaid who are providing you care what they know. Have they engaged with their federal lawmakers as an individual person or as an agency? What are their companies that own perhaps these entities doing? Are they aware of these cuts? What are their national organizations doing? Same for professional groups. We're finding that there are lots and lots of people who get paid with Medicaid dollars who are unaware that these cuts might be coming. And those dollars, Medicaid money coming into states really is to pay for the health care and long-term care that people receive. It isn't money that goes to individuals, it goes to workers. It's workforce. program. So it's really important that you kind of help, flag this and get the people who interact with you and their leadership engaged in monitoring what's going on and trying to influence the outcome. And with that, I'm going to stop sharing. We are a little bit over time. I apologize. But if we have any questions, we're certainly here to answer them.